First and foremost, and this is some of what the 10-year strategy is mentioning, is that the investment in health services doesn't necessarily reach the right areas and the right people. And overwhelmingly, when it comes to a lot of these issues, they're overlapping with social inequality and issues of just general justice. So you can't really tackle them in silos, which for a long time is what people have been trying to do. So I personally would like a system that is much more joined up. When we talk about we're talking about health, we're also talking about society, and understanding why people can't come for testing. So when you're working in areas like I do, which we know have high areas of high social deprivation, we know that there's transportation poverty, work contracts when people are on 0-hour contracts, when people don't get paid if they don't come in, you taking a day off even if you know it's urgent, well, your rent's urgent. that precarity is very urgent. Like, of course, for somebody that doesn't live in that precarity, you might not necessarily get why you would delay coming for a test or why you wouldn't come if you have pelvic pain, but ultimately, you know, being sacked would throw that person's whole livelihood into a tailspin. So I think for me, sometimes often you get told those conversations are too large to have. They're too macro. We don't have the time. We have to bite off what we can chew. We need to focus on screening and prevention. And I'm like, that's all well and good, but you really need to contextualize that and allow people to really marinate with the wider issues. So I think for me, it all starts there. I think building that level of understanding about the lives that live that are nothing like your own. I don't want to take too much time answering the one question, but I think, context is key for me. And making sure we have a holistic understanding of why we have these disparities in certain communities and how we perpetuate them on a global scale.